So I wanted to start with a little anatomy because you all are complex. There's a lot of things going on in your lungs, and I think it's good to take a look at the difference in where those problems might lie. So, just a reminder, this is what it looks like when you look inside your body for your lungs on each side, and then the heart that sits in the middle. And we divide the heart into right and left sides because the right and the left sides of your heart actually have different jobs. The left side of your heart is the one most people hear about. So when people have heart attacks or have congestive heart failure, that is usually what people are talking about is the left side of the heart. And the reason that is because the left side of the heart really does most of the work. It's big and thick and strong, and it sends the blood carrying oxygen to your entire body, so your toes and your brain and everywhere in between. When your body uses that oxygen up, then the blood's coming back through your veins and going through the right side of the heart, whose whole job is to send the blood right next to itself to pick up more oxygen in the lungs and then give it back to the left. And I tell you that to say the right and the left heart are a little different. So the left heart is created to be big and thick and strong so it can send the blood all the way around. But the right side of the heart, because its job isn't very hard, it's just supposed to send the blood right next to itself and back, is actually designed to be a little weak and floppy. And that's the way our bodies work the best. But if you develop high blood pressure in the lungs, which is what pulmonary hypertension is essentially, suddenly it's a little harder for that right side of the heart to squeeze the blood through the lungs. And so, pulmonary hypertension, although it's a lung disease, because the problem is happening in the lungs, patients actually get sick from failure of the right side of the heart because it's harder to push that blood through. So, when you have pulmonary fibrosis or any pulmonary, we call it parenchymal disease, meaning it's in the lung tissue. If you have any kind of a pulmonary parenchymal disease, be it COPD or pulmonary fibrosis or hypersensitivity pneumonitis or whatever your diagnosis is, it makes it doubly hard to get oxygen around because you have problems in the lung tissue here where the tissue's thicker than it should be, and so oxygen doesn't get across. But also these tiny little blood vessels that you can see down here around this alveoli that surround the lung tissue become damaged when you have pulmonary hypertension. So when the oxygen is trying to float across that little alveoli or airspace and into that tiny little blood vessel, it's damaged on both ends and it's doubly hard to get oxygen through. And so people who have pulmonary fibrosis or other kinds of lung disease who also develop pulmonary hypertension will be more short of breath and also have more hypoxia or low oxygen levels than people who have either one disease of the diseases alone.